So what can you tell us about CTC Academy?
So CTC Academy is a school for multiply disabled, medically fragile students. Our youngest students actually start on our Fairlawn campus at 18 months of age in our early enrichment program. Then we go all the way up to age 21 at our Oakland campus. It's an organization that has been in existence. We hit our 70th year. So over the years we've evolved to be, we used to do outpatient clinics and things, and we really are a very well-known, established private school now, and we serve students from many counties: Bergen, Essex, Passaic, Hudson, Sussex. Come to our program. They come to our program because their needs are not being able to be met in their local school environments.
And what are some of the special needs that you face here among your student population?
Many of our students have significant medical issues that require them to have a private duty nurse that come to school with them, medical treatments throughout their day, specialized equipment. We probably see the most rarest of genetic disorders here that often, parents will come to us, and it's a diagnosis that maybe there's, 200 kids in the United States with it. So it's very specialized. These children here that come here need to have extensive occupational, physical, and speech therapy throughout their curriculum, and a very adapted curriculum.
So in addition to their general educational requirements, you also are able to sustain and maintain their healthcare requirements.
Yeah, so we work very interdisciplinary. So it's the educational component, therapeutic component, and medical team. And they overlap so much that we all have to work very closely to ensure that the kids can come to school every day and get the most out of their activities here.
And what role does oral health play in all of this medical and educational attention?
So it's such an important piece for us. It's one of the things that, as when we have intakes and we have new students coming in, that's one of the first questions we ask in the intake process is, what is their oral health routine? What do you see a dentist currently? Do you have concerns about their oral health? Because we know that oral health is so important for function in life. Because many families, as I spoke today in my presentation, many families have a difficult time with accessing dental health. So they're very happy that we take a very proactive approach, and we have a toothbrushing program here. We work with families on, looking at what are different alternatives for helping oral hygiene at home. Recommendations of dentists, recommendations of maybe ways that their child can be in a dental office. Every day, oral health is very, very important, and it varies because of the multiple needs of our students. So we have to be quick to adapt.
Okay, so as part of the day, do you teach the students how to brush their teeth, how to floss, how to rinse, that sort of thing?
So we do. It's modified with many of our kids. We have some kids that can use a regular toothbrush on their own, and it could be part of their occupational therapy goals with learning how to brush their teeth. But that's often one of the goals in their program for their self-care and activities of daily living. We have other students that are not able to even hold a toothbrush themselves, or even an adapted toothbrush. So we are doing the oral health component for them. So it's very individualized based on what the students' needs are.
And because of their other medical conditions, what impact does the oral health have on those conditions, or vice versa?
So we do find often that because of different medications they're on, because of dietary issues, oral motor issues, it can greatly impact the oral health. Many more problems for many of our students. It could be craniofacial features, the way that development and of when their teeth come in. So it greatly impacts, the disabilities greatly impact their oral health. In the same manner, oral health is sometimes put on the bottom of the list with parents because of the many other issues that the families are attending to.
Okay, and also during the presentation today, you're speaking to a room full of dentists, dental hygienists. What can they do to help improve the care that they provide to families and children and anyone with special needs?
I really feel communication is so important with families, and I think, starting that communication, having a very detailed intake form to give families prior to them coming in so they have an understanding before the patient walks through the door. That communication is so important, and really bringing in the whole team, as Dr. Spivak said, it's that team approach of having the medical providers, the dental providers, the therapists, the family component, everyone really working together to make it a successful experience at the dentist.
Is there anything else you'd like to add about the importance of oral health in this population?
I think it's so important because poor oral health can lead to other medical issues, and many of our students have so many medical issues to begin with that if we can prevent further infection, further health issues down the road, it's so important. It's so important for function too, for their ability to speak, their ability to orally eat. So it's so important. Preventative is really a key piece.
Okay, great. Well, thank you for sharing your time with us today.
Thank you.